Welcome to surgery. My name is David. As I said before, I'm a surgical tech. I've been doing it for almost 17 years. I've worked in trauma one centers. I've done everything from gunshot wounds to just cutting off a toe. There's not a part of the body that I have not done surgery on over the years. I mean, every part of the body I've done something to. Here in Mooresville, our main focus is total joints and belly, intestines. I work for one of the orthopods here, and his name is Dr. Meeting, and we do total knees, total hips, and total shoulders. And has anybody here ever had a surgery? What do you have done?
I had tubes.
Little poke, little tube, yep.
I had my nose done.
What'd you have done to your nose?
I'm not for sure.
Okay.
I think it. Not to stick now. That's why I got here.
It's lots of ice cream.
Stitches in my head.
Ooh, what'd you do to your head?
Angled on a bumper on a car because I wasn't paying attention to where I was going.
I got my finger cut off.
Oh,
Stitches in my head again.
My mouth and tonsils.
My elbow and my tonsils.
okay. Ooh.
My pinky.
Oh, that's fun. Yeah, those guys over there.
A dog bite on my leg. They had to clean it out and get all the ugly stuff out of there.
Okay. There are many different kinds of surgeries that everybody's had different versions. Like I said here, we do total hips. This is a hip implant. This is something like what we put in after the surgery is done. We put this in and close up. We start out, you guys all did the ed heads, right? On the computer, did a total knee, total hip, that kind of thing on the computer. Okay.
The what?
Ed heads?
Yeah.
Yes. This is like the cheese grater looking thing that they had on that show. This goes up into the pelvis and prepares the acetabulum for this cup. We take this cup and we pound it up in there, and then we take the same drill with a different tip on it and we drill down into the bone, and then we take this and we pound it down into the femur. Now, what I want you guys to do is put your leg back like this. Okay? Now try to bring it out to your side. It's hard, isn't it? It won't go all the way out, straight out.
Nope.
So, when I'm in surgery with my boss, after he makes the incision and gets all the way down to the bone, I actually grab the patient's leg and twist it the rest of the way so that it dislocates the hip. And then we stick this, the mother-in-law, underneath the bone and pry it up so that the doctor can take this and cut the head off the femur. And that's how we can get this down inside. And then we take this and after it's all in place, I relocate it, and then the patient can walk, they can sit, they can run, all without pain, because we took care of the bad bone. You can pass that around.
It's all worth it though.
It's gonna fall off.
I bet it's all worth it.
This is a knee. This part was in the femur, or in the tibia. This part was on the end of the femur. This is standing. This is sitting. This is walking. You can pass that around. This was in a patient, and we took it out and we put in a better one because that one wasn't working very well. So you'll see right here, this is actual bone and this is cement. Who's ever heard of organ donating? You know, you see the commercials, organ donating your organs.
Yeah.
That is bone from a cadaver, a dead person. They donated their bones to be used on other people.
I don't want to touch it.
One of the other surgeries that we do here is the belly surgery. And what we do is we take this. This is called a trocar. We take a scalpel. We make an incision in the belly button. We take this and we shove it in the incision that we made in the belly button. Then we take this out. We take the camera. And we go and we look inside.
Oh!
It's my hand. This patient has a bad case of the kids. Say ah.
I'll do it.
Come here. My teeth are really bad sometimes.
Some of the other tools that we use in belly surgery is like this. This is a grasper. This we stick through other ports, and we can grab like the intestine, so the appendix or the gallbladder, and we move it around so that we can work on it.
Here, I didn't get to touch it. It's cool.
Brittany over here is wearing what's called a toga. This is what I have to wear when I'm in surgery. There's this helmet has a fan up here on top that's hooked to a battery, and it sucks in air and blows it in there so that I can breathe. This shield protects me from flying bone and blood and everything from getting on me, but it also protects the patient from me, because I'm inside and this is sterile when we're in the OR, and so anything that's on me does not get on the patient. After we're done putting in the hip or the knee and it's time for me to do the closing, you know, the doctor's done, he leaves, and I got to close up the incision. Before I close up the incision, we take something like this.
I got it in my eye! I got it in my mouth! Hit me again! Hit me again! Hit me again!
And we wash out.
Is that water? Hit me again! Hit me again!
Good thing I was wearing glasses. Good thing I was wearing glasses.
But this room is hot and the water's cold.
That was fine. Good thing I was wearing
Why do you spray her?
She's got it.
Take the helmet off the sprayer.
We wash out the incision with that, and then we close. That has that doesn't have it in it, but when we're in the OR, there's antibiotics in there that help kill bacteria, so that the patient doesn't get an infection.
That's what they did.
Wound. Does anybody have any questions about surgery?
No, I never.
Uh-huh.
Get a shot in your arm, make sure that you're asleep. How do they
Okay.
Hey, there's the Beasley. Look at this Beasley, guys.
Mrs. Beasley, we see you on camera.
First one.
You were just like, no, and I goes. I go like this. I turn. Miss Beasley,
Okay, now you're not.
If you stick something in your belly button too long, you die.
If you do what?
If you stick like whatever you did like to your belly button, or yeah, that thing. If you stick it in your belly button, just stick it too far, can you die?
Too far?
Yeah.
Now, back when I first started doing surgery, these were made of metal, and they were really sharp, and if you weren't careful, you could poke the bowel, and then you'd have to fix that too, besides whatever you were doing. But now that they're made of plastic, and they're still kind of sharp, but the surgeons are more careful, and you can actually put the camera inside here and watch. and you can watch where you're at. So when you break through the tissue, you'll know, and then you don't push so far. Okay? Any other questions?
Two things. What would happen if you wake up during your surgery?
The anesthesia will give you some more drugs.
And what's the most common surgery that you do?
That I do now,
Yes.
total knees. Before I got into ortho, I'd say the most common surgery I ever did was like gallbladders and appendix, stuff like that. Those are, everybody has those pretty much.
Even if it's something simple, they still do a surgery on it. If it's something simple, but can get worse,
Depends on what it is. These are actually different chucks that go to this, and this loosens and tightens just like a drill you have at home. Goes to what's called a Charnley. I don't have the rest of it down here, but it's a retractor that holds the skin and muscles out of the way while we do a hip. Any other questions? I forgot the first two groups, but you can get a hat out of that box if you want one.